Good morning, everybody. I'm Grant Colfax, Director of Health. Thank you for joining us today. I'm here today to share with you the overdose data released by the San Francisco Office of the Chief Medical Examiner, and also sharing about the Department of Public Health's most recent efforts to save lives from overdose by helping people enter and stay in life-saving treatment for fentanyl addiction. As you know, illegally manufactured and distributed fentanyl is killing people in San Francisco and nationwide. According to preliminary data released this morning, 56 people unfortunately died from accidental overdoses in San Francisco in April. Year over year, this is 21% fewer than in April of 2023, when unfortunately 71 lives were lost. For some comparisons, in the first 4 months of last year, we had 275 accidental overdoses, and this year we've had 258. As has been the trend since the city started tracking these data in 2020, more than 70% of overdose deaths in April were caused by fentanyl. As some of you may know, last week the Centers for Disease Control and Prevention released data from 2023 that found that fatal overdoses in the US fell by about 3%. While small, this first annual decline in overdose deaths, this is the first annual decline in overdose deaths in about 5 years, since fentanyl arrived in the cities on the East Coast. However, the data does not account for regional differences in the illicit drug market. For instance, fentanyl arrived on the West Coast, including San Francisco, later than it did on the East Coast. And as an example of that, cities on the East Coast, such as Philadelphia, saw increases in fentanyl use and then subsequent overdose deaths roughly 3 years before we saw similar patterns on the West Coast, including here in San Francisco. While some regions of the country may have already seen their peaks in fentanyl overdose deaths, other regions, potentially including the West Coast, may have not. However, I think it's important, while we continue to deal with these too high death rates, the fact that so many people are dying across the country, in the state, and of course locally here in San Francisco, the important thing to know is that there is an answer to fentanyl dependence, and that is treatment and recovery. We have life-saving medications available, highly effective medications, specifically buprenorphine and methadone, that reduce the overdose risk of death by about 50%. And they are accessible to anyone here in San Francisco, including and especially through our Department of Public Health system of behavioral care. Since 2020, DPH has been rapidly expanding our system to make drug treatment more accessible than ever and to serve more people in those treatment programs. We know from our outreach program that there is a demand for medications to treat fentanyl addiction at night. And in that regard, I'd like to now welcome Dr. Joanna Eveland, who will tell you more about an exciting pilot program connecting unhoused people to life-saving treatment at night. Dr. Eveland.
Thank you. Thank you, Dr. Colfax. To reiterate, DPH has been systematically and thoughtfully expanding substance use treatment services to make addiction treatment in San Francisco very easy to enter. We have also put a lot of resources behind support systems that help people stay in recovery and reach their health and wellness goals. Fentanyl has been an unprecedented challenge for communities nationwide, and in San Francisco, we are responding to the challenge with new and innovative initiatives that make the greatest impact on people at the most risk of overdose. This spring, DPH launched a pilot program to provide on-the-spot buprenorphine prescriptions to people using fentanyl in public spaces at night, and whenever available, a safe space to start the recovery process. These in-the-field consultations consist of phone visits with an on-call doctor who assesses the individual's substance use and shares the range of treatment options that are available. For people interested in buprenorphine, we're able to write an on-the-spot prescription that can be picked up as soon as the same night at a 24/7 pharmacy. In the first 4 weeks of the pilot, I'm pleased to report that we recorded 173 telehealth consultations that resulted in 134 people being prescribed buprenorphine for treatment of their opioid use disorder. Looking at all of those prescriptions, 33% of people have picked up their medicines. For individuals that would like to start methadone, we connect them the next day to an opioid treatment program. We have found that when we have combined the evening telehealth with safe and stable shelter, where people can start their medication, receive support, they are 3 times more likely to enter recovery. Under this pilot, many of the individuals who have committed to starting medication for their fentanyl use disorder have been sheltered at either the Adante Hotel or another available site in the community to start their medicine. We have been using rooms that were previously reserved for quarantine emergencies, but not currently needed for those, thankfully. And over the 7 days somebody is with us at the Adante Hotel, every day we see people in their rooms. Our SFDPH case management team knocks on their doors, helps them eliminate any barrier they may be encountering to starting substance use treatment, whether that's lack of ID, lack of insurance, lack of transportation. Anything needed to support their recovery and develop a long-term treatment plan. In just the first 4 weeks of the pilot, more than 55 people have started medication or entered residential treatment, or both. And now I would like to introduce one of our social work partners, Mauricio Romero from the San Francisco Community Health Center. And the Department of Public Health thanks the San Francisco Community Health Center, Code Tenderloin, 5 Keys, and the San Francisco Department of Homelessness and Supportive Housing for their partnership in this pilot program. Thank you, Mauricio.
Hello. Hi, I am Mauricio and I am the program manager at San Francisco Community Health Center and a part of the team that's been providing support services to help starting recovery under this public health pilot program. We are all well-rounded and close-knit that moves very quickly over a guest to address a client's immediate needs and create a personalized long-term treatment and care plan for each one. Recovering from a substance use disorder is challenging for anyone, but especially difficult for someone experiencing homelessness. People need a safe and stable environment where they can start medication and maintain stay contact with caseworkers whose job is to help them navigate the system. Under the pilot, the morning after an individual actually they start medication for their substance use is sheltered, our team meets with them to facilitate their recovery journey. If they have not already picked up their buprenorphine medication or received it by delivery, we arrange transportation to the pharmacy. Or if they have opted to start methadone treatment, we arrange intake at one of our local opioid treatment programs. Then we enroll them in public insurance and work on getting them their basic necessities and personal care items and state identification to continue the process. We also have medical staff on site to provide non-urgent medical care, such as nurses, but also an on-call staff to address more urgent needs as well. Clients have been excited and surprised by how much support they're getting, and we are seeing results. Not only the people sheltered at the Adante starting medication at a rate of 90%, I'm proud to share that we have seen about a dozen people who started treatment at the Adante enter a long-term residential treatment program. With treatment and support, anyone can recover from opioid addiction. Thank you.
Thank you so much. And I also want to mention that we're joined here by Dr. Hillary Clemens, who's our Director of Behavioral Health and well known to many of you for her expertise and her work on expanding our system of care. So we have a few minutes for questions.